I chose the MD MPH program here at Tulane because I was really interested in disaster management, and Tulane is unique in that many MD MPH combination programs just have you get a general MPH, but I was kind of really interested in this specific field of public health, and Tulane allowed me to get the combined MD and MPH in disaster management, so in a specialty of public health basically, all within 4 years.
I chose the MD-MPH program just because I thought that the public health aspect of medicine was so important, and you couldn't really get a full scope view of the medical system just through medical school.
I chose the MD-MPH program because I wanted some flexibility in my future career. I didn't know if maybe I want to practice medicine forever or want to go into something else, so I thought that was a great way to give myself some options.
So I chose the MD-MPH program because I feel like the MD program does a great job of allowing us to treat patients, but as physicians we don't necessarily have a lot of training in community exposure and understanding how diseases or risk factors affect our communities on a larger scale. And I think when we were asked whether we wanted to be a part of it, I think incorporating those two things is really key to being a great physician. Understanding not only things in treating your individuals and the patients that you serve, but also your larger community. And I think just having the identities I do, being a Black man and also a queer identity, understanding risk factors and things that may attribute to poor outcomes in our community desperately need to be researched, and we need advocates in those fields. And I think the MD-MPH program really allows me the ability to do both, which I'm very grateful for.
I chose the MD-MPH program because I was a sociology major in college. I went to Tulane for undergrad, and I really wanted to expand upon a lot of the knowledge I gained as a sociology major. So not just understanding what affects a patient's health and social determinants of health, but how to actually apply what I've learned at the community level. And that's where I thought my MPH would be a great bridge between that knowledge. I thought it would add a lot to my MD degree and give me opportunities to decide what I wanted to do in my future career.
The program incorporates real-world public health challenges and issues into our everyday life in a lot of ways. You know, the School of Medicine is really great about student-run clinics, going out into the community, and the School of Public Health does really well on preparing you for different types of populations that you're going to work with and different ways that you can go about talking with them and getting to know them and getting all of the information that you need to really help them to the fullest extent.
There was a lot of real-world application. I think one great way is the fourth-year practicum. I really enjoyed actually working with an administrator and getting to help make some of those decisions and interact with other people in the field. I also remember getting lots of lectures about the history of public health issues, which was very helpful because that just informs where we are today.
I'm personally interested in disaster management, so I've spent a lot of time with hurricanes, with Mardi Gras, with our planned and unplanned disasters that we have here in the city. And I've been able to, thanks to my advisor, Dr. Murphy, who's really connected with that apparatus in the city, intern at the New Orleans Department of Health, at the Department of Homeland Security and Emergency Preparedness. And that's been times where I've really worked on the ground doing real-world public health stuff. And then I see a lot of those public health issues that we talk about in class reflected in terms of my patients in clinic, the different barriers that they face in terms of access to care or health insurance or hurricanes, whatever. And I feel like because of my public health education, I definitely have a little bit of more of a depth of understanding in terms of taking care of some of those barriers for patients.
There's so much to be done in our community, and I think public health is such a beautiful way to incorporate both creativity and science. I think that there's such creative minds in this field, and it's been amazing to work with the professors and associates that we have that really incorporate the experiences that they've had in their own lives and using the science background that they have to really create these projects to measure outcomes that otherwise really wouldn't be researched.
I've heard a lot of different perspectives from our professors and other students just about the state of public health today as it is and ways that we can kind of change it. So that's been really great. I also think something that's underrated but meant a lot to me was a lot of the biostats and epidemiology we did came up a lot in my MD training, and I felt like I had a leg up on those topics. And that was really great because it takes a lot of the pressure off.
I think the biggest takeaway regarding my public health training was really taking a step back and viewing the whole system as a whole picture. During medical school, it's really easy to get your head down and really caught up in the day-to-day tasks and little things, but really having that public health aspect and being able to take a step back and see the big picture and remind yourself why you're doing this was really important to me.
I have loved my public health training so much that I spent a lot of my time in medical school, my extra time, my volunteer time, my elective time, working with the New Orleans Department of Public Health, with the New Orleans Department of Homeland Security and Emergency Preparedness, working on how do we keep people healthy during Mardi Gras, how do we vaccinate large groups during COVID, during MPOX, during hurricanes, and I've been able to work with our local New Orleans experts during these major events. And I've loved it so much that I've decided that that's what I'm going to do in my career. I definitely got involved in research while at the School of Public Health. I actually decided that I loved my MPH research so much that I spent a whole extra year and graduated in 5 years because I actually decided to take a year out between my 3rd and 4th year of medical school and take a full MPH research year. With the assistance of Dr. Krusselwood and some of our awesome faculty in the School of Medicine and the School of Public Health, I applied to and was awarded an independent NIH grant through the Center for Clinical and Translational Sciences. It was like a CTSA award, and this supported me to spend a full year studying medication adherence among older adults with hypertension in the Gulf South during hurricane season.
So a lot of the research that I did in medical school was actually through my MPH. And I decided to do research in the fields of maternal child health. I did some research in surgery and combining that with my public health degree. And ultimately, I felt that my research experiences with my MPH is what helped me decide on my specialty of ENT.
I would say my research experience, especially through the MPH program, being in the epidemiology school, really focused on data analytics. I think it was definitely harder work than I anticipated, but something that I'm really grateful for because I've learned a lot of skills within the department and I feel competent given a data set, being able to identify risk factors, being able to identify what is attributing to disease, as well as exposures and outcomes.
I didn't have any specific research with the MD-MPH program, but I did do a lot of advocacy and policy work. And so really having those background classes in health policy and some of those, really foundational courses really helped me to be able to go further with those efforts. I was able to write a resolution that got brought to the House of Delegates, and none of that would have been possible had I not had that really solid base that the MD-MPH program gave me.
We discovered that older adults in the city of New Orleans have obviously been through so many hurricanes that they really know what they need to do to be prepared, but there's a barrier in terms of health insurance companies offering to cover their extra medications. So we as health departments and even like the Red Cross and national agencies recommend that people have so much extra medication on hand in order to prepare for hurricane season. But health insurance companies don't cover that extra medication. So when we talk to older adults, they said, trust me, I know I should have extra, I've tried to get extra, but here's the barrier to my insurance company. So we were able to write a paper, which is now being published, which hopefully we will be able to share with insurance companies and kind of work on some of these access barriers.
In the summer between my 1st and 2nd year, I was awarded a scholarship that allowed me to study women's transition to menopause and how their transition can be affected by chronic psychosocial stress, intimate partner violence, things like that. And ultimately our work was published this past January.
I think that there's such creative minds in this field, and it's been amazing to work with the professors and associates that we have that really incorporate the experiences that they've had in their own lives and using the science background that they have to really create these projects to measure outcomes that otherwise really wouldn't be researched. I think a lot of the professors that I've had have really either had family members that have been affected or communities that have strongly been impacted, and no one's doing the work that they're doing, and it's really empowered them to be focused and driven to get that work done.
So I did some pediatrics research. It was pediatric psych research. And so One good thing was I was able to learn a lot about the process, the behind the scenes work of doing research, but it informed my career choice. I'm going into pediatrics, and I just realized that I really enjoyed working with kids, so that's what led me there.
Really, for me, like the most complimentary thing has been in mentorship, because through just my public health research, through my public health internship, have met physicians who are working out in the community who I might not have met through just the regular medical school, but they're these amazing public health physicians who are now helping me also in my medical journey for residency and things like that.
I remember thinking throughout my first and second year that some of those MPH classes should be required learning for all MD students, especially the epidemiology stuff, just learning about how diseases transferred, stuff like that was really helpful.
When it comes to our board exams, when it comes to our testing, as well as questions that you'll even be asked in the hospital, a lot of them are public health centered, and I think having that training really does allow you to shine in your clinical practice.
I think a lot of the education that you get as a medical student, can't be looked at just in a vacuum. It has to be looked at considering, the world around you, and I think that's a really great place where public health comes in and helps you to understand that. So when you're trying to understand the disease process, you're able to understand, the epidemiology of that disease, and also, what we can do as public health experts to help mitigate risks.
Coming to the School of Public Health, you learn really about health insurance, about policy, about larger trends, and then being able to take that to your education about specific diseases and different disease states. And being able to put that together really makes it stick better in your head. It makes you have a better understanding of why this is all important. And in my career, I want to continue to do work with advocacy and policy work, and this has really set a strong base for me to do that.
For my future career, I really want to be able to influence policy, if not create policy. So knowing as a doctor how those things are going to affect me, and then knowing how they actually work and how you can create new policy is going to be very helpful.
So my career aspirations following this program are to be a resident in anesthesia. Anesthesia is very big into advocacy, and so it's really helped me to get into that field a little bit more and work with not only public health advocacy, but advocacy for my patients every day in the OR. And then additionally, I have always wanted to do global health, and this program has really prepared me to do that and to help set up sustainable programs around the world that involve the community and involve community programming, and make sure that we're looking at it from a sustainable point so that this is something that they can build upon and helps the safety of all their patients.
So I'm planning to go into family medicine, and I'm heading to a family medicine residency that has a really strong public health focus that will allow me to work with a health department while I'm in residency. And long term, I hope to be like a family medicine doctor who still has the time to hopefully lead a health department.
Actually, many of my interviews for residency, one of the main questions I got was, what do I hope to do with my MPH degree after medical school? And that was a big question for me too. That was something that, I wasn't really sure what I wanted to do. When I first got my degree, I knew it was important to me, but something that I started to develop as I progressed throughout my medical school education. Ultimately, I see myself using my MPH in research. I'll be going into otolaryngology this summer, and ENT is a field where their public health research is needed to understand a lot more about the epidemiology of our diseases and pathologies, and so I'm really excited to use it in the research field. I'm also excited to see what collaborations I'll be able to do as an attending physician, whether that's through research, healthcare administration, things like that.
So my aspirations are, I'm planning on going into internal medicine, hopefully to be a nephrologist or a kidney doctor. I really want to incorporate both the effects that it has on Black patients as well as Hispanic patients and queer patients. But I think the public health school has allowed me to recognize how to run my own project and recognize risk factors in my community. So an example is, for my practicum project, I went to a dialysis center in the city and I ran a survey to assess patients' understanding of kidney disease, health literacy, as well as their ability to manage their own kidney disease. And what we found was that people, although may have a high understanding of kidney disease, don't manage them very well. So in the future, when we give presentations or bigger talks to people in the community, we can better tailor those presentations and lectures to help them manage their disease better. And that's something that I'm really interested in. And I think one of the core tenets of medicine is patient education and being a better educator for your patients. And I think tying that in from both my medical training as well as running my own studies to show that public health is a necessary component to run those studies and prove those risk factors is how I plan on tying those two things together. And I think I'm most grateful that it's not necessarily me creating something new. I feel like it's kind of a path that the doctors before me have allowed me to follow, and something that I'm just following the path and hoping that in the future, other students that enroll in the MD MPH program can gain from and just continue that work on and on so that it all works for the benefit of our patients.
I'm going into pediatrics, and there's a lot of preventive medicine in pediatrics, a lot of policy as well that goes into kind of shaping the care of our children. So getting my MPH has been really helpful just to prepare me for that and hopefully be an advocate for my patients as well. Advice I would have for anyone interested in the MD MPH, I would say make sure you are considering ways in which you could budget your time, because it was always important to me to show up to my MPH classes and be able to fully focus, even though you still have a million other things going on with the MD. But all of the professors are really understanding. So if I ever needed a day or an extension, they were like very kind about that. But of course, you want to do your best to make sure that you're spending equal time on both.
Tulane does a really wonderful job at making the coursework manageable for students that want to pursue dual degrees. There's a lot of time between your summers and during your fourth year to finish requirements, and ultimately I'm really happy I did. It was something that was asked about a lot in my residency interviews and something that I'm really looking forward to tying to my MD degree in the future.
Hold on to your why. I think, especially in this process, being a dual degree student, it is harder balancing both medicine and public health school. But I think whenever it got really stressful or whenever it was really hard, I always just remembered that there aren't enough people doing this. And I think knowing the identities that I have and who I am as a person, that I really wanted to help Black communities. I really wanted to be an advocate for queer health. I think those things always centered me and grounded me. And I think doing the work becomes a lot more difficult when you're not connected with your why. So whether that's writing it down or looking at it every day or journaling it every day, I think holding on to that allows you to push forward even in the hardest times.
I think our medical school does a great job of prioritizing public health, even just for the general MD only students. But I think if you are someone who wants to use public health a lot in your career, as I did, you should strongly consider this program.
There's so many great opportunities involved within the programs that you wouldn't get access to if you were just doing your MD. I had the opportunity to go to Italy and participate in a food resilience and security course where I really got to learn the whole system from the top down and meet with UN delegates and just experiences that I never would have had otherwise.